Good morning, Las Vegas, and welcome to A Healthier Tomorrow, your dose of inspiration, information, and action to build healthier communities and Southern Nevada's #1 community health program. I'm Will Rucker.
And I'm Sierra Owens.
And we are thrilled that you are with us today. We've got an important show lined up because today we're talking about two of the biggest drivers of health across a lifetime: childhood well-being and community health improvement. So tell a friend, text your group chat, call a neighbor, and let everyone know A Healthier Tomorrow is live. And this is a conversation that they don't want to miss. So before we get into our topics, Sierra, it's the first week of school.
Yes, it is the first week of school, y'all, across the valley. I'm sure you've noticed the traffic and all the kids. So y'all in the school zone, slow it down, be safe, and stop so our kids can make it to and from school safely, please.
Absolutely. Please do. And don't do U-turns in school zones.
Oh, no, that's an automatic ticket, and the cops are out, y'all. I don't know if y'all been seeing them. I've been even like, Sierra, slow down. And I know I'm aware of what time of year it is.
That's right. Make you healthy in your body and save you some money in your pocketbook so you don't get those tickets. So tell us, now, you support our incredible educators in this community.
Yes.
What's one thing that we really just need to know right now?
Honestly, y'all, ask your kids, like, what happened in their day, and not even in particular, like, how was your day? Like, because then they're going to shut down. It's going to be like, good, great, fine, whatever. Be a little more specific. Ask your younger kids, like, what's something that made you smile today? Ask your kids in middle school, maybe if you painted a picture, what color would be in your picture of your day? And your older kids, what's the soundtrack of your day for today? Because it might spark some more conversation. Allow them not to shut down because our kids' minds are running. So it gives them that space to be able to tell you more. And give your teachers grace, y'all. Give them grace.
You know what? That's good advice for your spouse, your girlfriend,
yes.
boyfriend, other friend, whatever. Yeah, that's good.
Yeah, so and we can sit there and share this later. But there's even with your spouse the question of asking, like, if you could do one moment over today, what would it be and why? And oftentimes when people hear that question, they think they want to lean into like the negative part of the day of, I want to go back and fix it. And sometimes it's like, no, actually, I want to feel that laugh again.
Yeah.
I want to feel that hug that I got from Will Rucker when I walked into the studio this morning. Like what that could feel like, and how it can go throughout the day.
Yeah. So maybe if you're listening, I'm going to ask you that when we get home. All right. The Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Southern Nevada Community Health Center is a federally qualified health center that provides various primary care services for all ages. For questions and to schedule an appointment, please call 702-759-1700 or visit www.snchc.org. With that, I'd like to welcome our first guest calling in today from Reno, where it's just a little bit cooler. None other than Dr. Stephen Shane. Good morning.
Well, good morning. How are you?
I am great. So glad that you are on with us today, and you've got some important information to share. So before we get into that, I'd love to hear just a little bit about your background, and I know that you're with UNR and at Renown, so let our listeners know exactly who you are.
Yeah, I am a pediatrician at Renown Health. I'm also I'm a clinical associate professor of pediatrics with UNR School of Medicine. I run the Healthy Lifestyles Clinic here at Renown Children's Hospital, which focuses on good lifestyle and healthy weight. I also work with the state on the Nevada 5210 program, and also work with the Nevada chapter of the American Academy of Pediatrics as an obesity prevention advocate.
Awesome. So we've got a heavy hitter with us this morning.
And great company.
Yes. So, something I found really interesting is that about 20% of kids and 40% of adults are actually obese. So if we could just kind of start with there, what is obesity?
Obesity is a chronic progressive and relapsing disease that has metabolic, biomechanical, and even psychosocial components due to excessive fat mass in our bodies.
So when we think about obesity, especially because we know in 2023 about 1/3 of adults in Nevada were self-reported as obese, and that's the same as the national average, but we see it highest in like African American Indians, Alaska Natives, Blacks, and Hispanics in particular. What are the risk factors for obesity, and what makes these subgroups more susceptible?
Yeah, I think there's a number of risk factors, going all the way down, starting at a higher level regarding policy factors. Then there's community factors, family and home factors that can alter our weight, and then obviously going down to individual factors. I think the differences that we see across different ethnicities is multifactorial, and there's probably some genetics involved that we don't fully understand yet. And then obviously there's a whole lot of influence from social determinants of health, such as, where you live, educational level, economic factors, and so forth.
Yeah, we're going to get into those social determinants with our next guest, so I'm glad you kind of gave us a great bridge there. But I am curious, can obesity be prevented?
That's a good question. That's something that's been worked on very hard over the last couple of decades. And unfortunately, since it's such a multifactorial, complicated process, it's easier said than done. There's been a number of attempts to prevent obesity in communities, and there have been some good attempts that have provided some modest improvements, but it takes a lot of effort, a lot of money, a lot of personnel. I mean, you really need to involve the entire community, the many factors that make up a community to make a difference. Probably the best effort and outcome that I've seen recently was just a study that was published this year, where mothers starting in the third trimester were provided with education sessions all the way until their children were almost 3 years of age. And this study actually showed that those families that participated at the highest level actually could reduce the risk of obesity in their 4 and 5 year olds by almost half.
Wow.
Which is pretty impressive.
Yes, it is.
So
I think it's.
Oh no, go ahead, Dr. Shea. Go ahead.
Well, I was just, and I think that's important, just because typically what we're seeing is the weight that a child achieves by around age 5 or 6 typically is the weight trajectory they're going to stay on for the rest of their childhood.
That's a powerful statement, and that's a powerful thing. Even when we think about like literacy and kids, we like to start with the parents. So I love hearing that we're talking about third trimester on, so that we can set that trajectory from the beginning. Last year you talked to us about 5, 2, 1, and 0, and you mentioned it earlier in your intro. Can you tell us more about that and how that's something we can influence within our own households, especially with our children?
Yeah, 5210 or 5210, however you'd like to say it. Is a very simple but very powerful health message that highlights 4 different important behaviors that are associated with good health and also healthy weight. So the 5 is for 5 or more fruits and vegetables consumed on a daily basis, 2 hours or less of recreational screen time, 1 hour or more of moderate or vigorous physical activity, and 0 sugary drinks. This is a message that was developed in Maine back in 2006 as a local pilot program in Portland, Maine, in some elementary schools, and then it quickly grew to a statewide program within 3 years. And now it's something that can be found in 37 states and Canada. We started a Nevada 5210 program over the last couple of years, and we're trying to get it out through our state as much as possible, so we can try to establish this good health messaging to maybe improve overall health and weight in our populace.
Yeah. So, Dr. Shane, two questions for you. Number one is, does it actually work? And secondly, who's promoting this message for us in Nevada?
Well, in the state of Maine, where it's been around the longest, they have shown that there's good uptake in parents and children with their messaging system. And also they've shown they've been able to influence behaviors, healthy behaviors that are involved with the 5210 behaviors. And there has been some evidence that it can help stabilize or even reduce body mass index in certain age groups. In the state of Nevada, currently, probably our biggest participants are the Northern Nevada Public Health and the Southern Nevada Health District. Both of those organizations have been promoting 5210 for several years now and reaching out to schools, healthcare providers, promoting this messaging at health fairs, and incorporating that messaging into other health promotion projects that each of those health districts are working on.
I have a question for you, Dr. Shane. So I noticed that in 2021 and 2022 school year, Clark County School District had 33.5% of students in 4th, 7th, and 10th graders that were obese by their body mass index, compared to 23.7% in Washoe County. What do you think the difference is in the two environments that lends itself to a higher obesity here in Southern Nevada?
Oh, that's an excellent question. I'm not sure if I know exactly why there's that difference. It could just be a sampling difference for that particular year. Obviously, our communities are much different. Clark County is a much larger urban setting than Washoe County. Also, the ethnic mix may be different. That could lend to those statistical differences as well.
Thank you. Not to put you on the spot. I appreciate that. I just always like to compare, especially when it comes down to our kids. So how can we get more information and become more involved in this so we can really take our health in our own hands?
Well, I encourage people to go to the Southern Nevada Health District website, specifically the GetHealthyClarkCounty.org. That's where the 5210 program lives in Southern Nevada. And there's a lot of information, a lot of materials that citizens can access and share with their kids and their family and find out how to get more involved. And the same with Northern Nevada Public Health. There is a landing page on the NNPH website for 5210 that shows how schools can get involved, healthcare providers can get involved, and just families can get involved and start being healthier in their lifestyles.
Awesome. So what I've heard from you today, Dr. Shane, and make sure I'm being honest here, is small changes create some big results. Is that about right?
Correct. Yeah, if you can, I think if you can make, even the smallest change, if you can sustain it over a period of time, can really make a difference in your overall health and also your weight.
Awesome. Well, thank you so much for joining us this morning on A Healthier Tomorrow, and of course for the work that you are doing to keep our kids healthy. The Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. August is National Breastfeeding Month. Breastfeeding has many positive benefits for both mothers and babies. To learn more about available resources and support services, visit the Southern Nevada Breastfeeding Coalition website at snvbreastfeeding.org.
All right. So we have two amazing guests that we also had last year that are really going to allow us to take that conversation with Dr. Shane to a next level. So ladies, would you like to introduce yourselves?
Yeah, hi. Good morning, everyone. My name is Carmen Hua. I'm a health educator at Southern Nevada Health District in the Office of Disease Surveillance, and thank you so much for having us back again.
Yeah, of course. Thank you for having us. My name is Tamera Travis. I am an epidemiologist at the Southern Nevada Health District.
And these two individuals are absolutely fabulous.
Yes, all the way. We are so glad to have y'all. So today we know that we are really going to dive into the community health assessment. What is it exactly? A recap from last year for people that weren't tuning in.
Yes, so the community health assessment, it's a big project.
Yes.
We've been working on it for, the past year. But so basically it's a systematic process where we involve community, where we basically identify the gaps between the current and desired outcomes, and we want to help determine the community health priorities for the next 3 to 5 years. So that's kind of to sum it up, but we have been utilizing a framework that was developed by the National Association of County and City Health Officials, and it's called the MAPP, which is known as Mobilizing for Action Through Planning and Partnerships. So this framework has really helped guide us through the whole process.
Sarah, I don't think we needed to do a recap, to be honest, because
everyone handled their business right. We saying that we trusting y'all.
3,003 responses came in.
A few extra, 3,303.
Oh,
yes,
wow.
She said I put respect on all that.
Every single one.
So we were able to get a great deal of community feedback, and we were able to really use that data to see what's important to folks in Southern Nevada, which is fantastic. So thank you everyone for taking the survey.
Yeah. So tell us, what's the results? What was important?
What was important?
Or what is? Let me say that.
Of course. So this is part of the community status assessment portion of the community health assessment. So that's one of the 3 assessments. What is important? First off, let's talk about some demographics. We were able to receive 289 surveys from Spanish speakers, 46 from those who took the survey in Chinese. So we were really able to hear from a variety of different backgrounds. And what that ended with is that we received 1,700% of our quota for respondents. And those who are experiencing homelessness, 185% of our quota for respondents for those who are Native American and Alaska Native. So we're really able to hear from a lot of folks above our quota, so we did a lot better than what we expected. As for what we found from it, we found that a lot of people are worried about housing. That's been a big focus, as well as mental health. Things of that nature are things that we have been really wanting to focus on. And we did an overall overview of all 3 of our assessments to determine what 4 priorities are most important to take forward for a community health improvement plan. And I'll let Carmen talk about those.
Oh, yeah. But before I jump into that, I actually want to touch on the other 2 assessments too, because they are also a part of the community health assessment. So for the other 2, we did conduct a community partners assessment. So exactly what it sounds like. So we basically did a survey for our partners that we work with, who we want to work with, and previous partners that have been involved in the process. So we really just wanted to get them involved and evaluate, their own processes and capacities and how we can work together and collaborate in this whole, report. So really just putting collaboration out there and engagement with our community partners. So that's a huge emphasis that we really want to put out there. And also we conducted our community context assessment. So this was basically trying to gather the unique experiences and insights of community members' perspectives. So we actually did 2 separate little projects on this. So we conducted focus groups. So we focus on the people with disabilities, the rural areas, zip code 89101 specifically, seniors 60 plus, the veterans, and then American Indian and Native Alaskan. So those groups are really important to us, as we saw they are underserved populations in Southern Nevada. Along with that, I feel like youth is not talked about enough.
Yes.
So we really focused on conducting a photo voice this time around for youth 12 to 17. So basically they submitted photos talking about strengths and opportunities in Southern Nevada, and it was so awesome to see.
It is. That shows us like, what is the photo voice? I love that.
And you can see it online. You can actually see the pictures and everything from it. It's fantastic.
Yeah, we have physical copies too, so if anyone's interested, let me know.
Well, I'm interested. Give me a couple more, please.
I have them in my trunk right now. But yeah, so those are the 3 assessments. So as Tamera mentioned, we did the CSA, which was like the largest chunk, where we got over 3,000 amazing survey responses. So thank you to everyone for participating in that. But yeah, so from basically all those results, we are now in our CHIP phase. So the CHIP is the Community Health Improvement Plan. So this is the plan that basically we want to enact the effects of the community health assessment to address our public health opportunities that were raised in the CHA. So basically, it's a goal to improve the community by aligning our partners' organizations and developing those shared measures and create an action plan on how are we going to work on this together in the community, and basically set up a blueprint on how can we work together and which areas did we need to work on. So with all that information, we facilitated a prioritization meeting back in, I believe it was end of April, where we had over 195 people that actually attended. So I think it was a great outcome. So from that, basically we went over all of the health indicators and focused on those different key areas of opportunities, and we had amazing key speakers, and we actually had Will over here, representing access to care. So that was amazing. But out of the 4 that were selected, we did have 8. So we did focus on social determinants of health, access to care, mental health, chronic disease, public health funding, substance use, infectious disease, and environmental factors. So we actually had different criteria that we focused on, which included like feasibility, how Clark County compares to different benchmarks, as well as the quality of life, as well as just magnitude and effectiveness of interventions. So with that, we did select our top 4. So we have first access to care. So Will, good job. Second was chronic disease, and third is public health funding. But we did recently add substance use because it was decided by SNHG's Health Executive Committee. They were noticing the community needs, the stakeholder feedback, as well as the arising public health data, that this is actually a reflection of something that's going to impact our community. So we really wanted to include substance use, but also integrate mental health in that as well. So we're really excited.
Yeah, it is. It's hard to talk about one without the other.
Definitely.
And sometimes people try to put them in 2 different boxes, so we appreciate that.
Yeah, of course. So that's what we have going on right now. So super exciting.
I love it. I mean, it is exciting. It's also, as someone that's been doing this work for a long time, it's a little frustrating because we're still talking about some of the same things. But what I loved about the way you all engaged in this process was you really did include the community. And, in our community, we talk about mama and them. You got in them in the participation here. There's a story about a monkey and a fish where the monkey is like, oh, I'm going to save this fish from drowning because that's what, get in the tree. That's where I am. But we miss what people actually need when we don't ask them. And so you all did such an incredible job showing up at everywhere to ensure everyone and their voice was included. And that's why I also appreciate the prioritization meeting, because it wasn't just, okay, now we talk to you and we pick. It was, hey, community, what are the issues based on the data? So thank you for doing that.
Of course. And just to elaborate on the point that Carmen made about the prioritization meeting, that was a vote. So we looked at the size of the health issue. How many people in Clark County is this affecting? How serious is this? Is this something that you can manage by yourself, or is this something that you need, medical or professional intervention for? As well as how feasible is it for community partners in Clark County to act? How can we improve it? And based on that vote, that's how we came up with those top 3 priorities. And of course, substance use was added later on. But this was really a community process. So thank you for thanking us for our work, but we really couldn't do it without everyone else's participation.
So we've got about 60 seconds left.
Oh.
But before I want to make sure we get this out. Tell us about the health improvement plan process. Like, what's next? How can people get involved?
Yes. So actually, you can find all the information on healthysouthernevada.org. That's where we house everything. So everything we talked about today is on that website. We actually just kicked off our steering committee meeting back in July. So actually, if you're interested, we have a second meeting coming up August 27th. That's a Wednesday at 1 p.m. It's going to be virtual via Teams. So if you need the information, let me know. I'm more than happy to have you there at our table and discuss these important party areas. But other than that, we have our tentative date of having the CHIP report be released late spring of 2026. That's going to come up so fast. We'll be back.
So fast.
But yeah, we would love any agency, organization to be involved if any of those 4 priority areas stood out to you, and if you want to make impact. Like mentioned, community is so important to all this works, and we really couldn't do it without anyone here. So thank you.
You say to reach out to you, Carmen. How do they find you?
Yes. So you can find me at huac@snhd.org, or you can reach me at 702-759-1209.
Fantastic. Well, thank you both for joining us on A Healthier Tomorrow. We really appreciate your time and the work. Sierra, what's going on in the community?
There's so much going on, y'all. So there's going to be the 10th annual kickoff to kindergarten on Saturday, August 23rd from 10 a.m. to 1 p.m. at the East Las Vegas Library. There's going to be live performances. There's going to be a whole showing of Work It Out Wombats, which is a PBS kids show. Come out. It's at the East Las Vegas Library. It's free and open to the public. It allows you to prepare your child for school using the University of Nevada Reno Extension School Readiness. All attendance will be on hands-on activities, and you can learn more about pre-K and kindergarten standards. You will also be able to dive in on the Health and Wellness Forum and Mental Health Forum that is going to be hosted at Nevada Partners on August 16th at 10 a.m. This is a free event at Nevada Partners. Join them for an open and honest conversation about men's mental health. Let's break the stigma and end the silence together. There's also going to be a healthy relationships workshop at the center on August 22nd and September 19th. It is going to be including just really honest look into love, connection, and community straight from the source. You'll be able to feature live interviews from couples across all identities, dynamics, and relationship styles. So go ahead and join for communication and consent to daily challenges and joy that comes into a relationship. And then the Condom Couture 2025 from Dusk to Dawn is an amazing runway experience Friday, September 19th at Dusk Las Vegas, where we're able to really talk about safer sex and celebrating the look of really embracing condoms. Remember, if you are interested in applying and you have a design that you would like to share, go to thecenterlv.org, Condom Couture 2025, or you can go ahead and slide into Kenyande's inbox at kjakada@thecenterlv.org.
This has been A Healthier Tomorrow. I'm Will Rucker.
And I'm Sierra Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live healthier today. We'll see you next time.
Bye, y'all.